Obvious, right? If you don't want people to leave medicine, pay them well.
Oh, is it pretty obvious? What's going on, guys? My name is Dr. James Cellini, and I'm a board-certified practicing veterinary neurologist and neurosurgeon. On today's episode, I'm going to do some clout chasing. I mean, react to my younger brother's video, the other Dr. Cellini. He recently published a video talking about reasons why doctors are leaving the medical profession, and a lot of the points he brought up have very similar kind of corollaries to veterinary medicine. The report he cites also has almost like a doppelganger report from the veterinary version of the AMA, the AVMA. So I wanted to kind of use that as a primer and react to his video because I thought there were some good discussion points that he brought up inadvertently. And I'll probably take some shots at him along the way. But before I get into that, if you don't mind hitting the like and subscribe button, always helps the channel and the algorithm, as they say. And let's get into it. Let's get into it.
Now, you have seen me post many videos about med students and physicians quitting medicine, and you may think this is just a subset of YouTubers trying to get views.
It is a subset of YouTubers trying to get views.
There's over 124 different institutions across the country. I'm just going to go ahead and read some of this. The study found out that burnout, workload, fear of infection, anxiety or depression related to COVID-19, and the number of years in practice were associated with the intent to reduce work hours or leave. This is all again according to a recent published study out of Mayo Clinic Proceedings. And the study was not just shocking for everybody reading it. It was also shocking to the actual author of the paper.
And what is not shocking to anyone in the veterinary field is that these same issues are highly prevalent, if not more prevalent, in veterinary medicine. In the AVMA's 2021 Economic State of the Profession, they devoted an entire section to evaluating well-being and burnout amongst veterinarians. And as you can see in this lovely bar graph illustration, burnout levels increased to a 4-year high amongst associate veterinarians. Secondary traumatic stress scores, otherwise known as compassion fatigue, also increased to a 4-year high amongst associates. Now, interestingly enough, neither of these reports included radiologists in their survey because radiologists are immune to compassion fatigue, and that is because they never actually touch patients
who are experiencing the burnout. It was also noted that medical assistants, nursing assistants also experienced some of the highest degrees of COVID-related stress and burnout. Many healthcare organizations nationwide were having trouble filling medical assistant positions. Many hospitals and clinics are not fully staffed because of everything I just mentioned a minute ago. So you can imagine that this actually puts further strain, increased work, and stress on the remaining healthcare workers.
Now, anybody who works in veterinary medicine knows this holds true with vet med also. Vet techs, vet tech assistants, receptionists are suffering an inordinate amount of burnout and compassion fatigue, just like veterinarians are. And one of the main reasons for that, in my opinion only, is these people across the board are not paid enough.
Touch on a few reasons why I personally think healthcare workers are leaving medicine. So let's touch on a few of those reasons. Number one, the elephant in the room, none other than what's causing this entire pandemic, the COVID virus. Now, this is obviously a huge topic, and a lot of people.
The 2021 AVMA report showed that of the students surveyed, a significant number of them reported either somewhat or dramatically decreased well-being due to the COVID-19 pandemic. Now, the general thought in veterinary medicine is that the COVID-19 pandemic led to a huge spike in pet adoption and general pet ownership, and that is what has led to veterinary clinics across the country being so busy. One research study in 2021 found that there is an uptick in Google search trends for adopting pets, and there is a general increase in public interest for pet adoption. But an interest versus actual pet adoption seems to be two different things. Another study in 2021 that actually looked at pet adoptions in the US found that pet adoption rates were actually lower compared to prior to the pandemic start in March of 2020. So from what I can tell, the actual evidence supporting the fact that increasing adoption rates and pet ownership is what's causing the spike in demand for veterinary medicine is a little bit lacking. I don't think there's enough evidence to really blame it on that. If I had to guess, my sense of it is that the pandemic has caused an issue with staffing at the primary care level, and this has caused basically like a squeeze, almost like a short squeeze of a stock. And all of the patients that a primary care doctor would typically see are now being seen at 24/7 ER and specialty centers. And these cases are cases in addition to the already huge caseload that these hospitals have to work with. All right, let's keep going.
However, the second reason why I think doctors and other healthcare workers are leaving medicine is because of burnout, which is something any healthcare worker is familiar with. Now, a lot of this may overlap with what I was just talking about. However, working longer hours and more shifts is definitely not sustainable and can quickly lead to burnout. Now, I know what you all are thinking. Why is this radiologist talking about stress
I know that's what I was thinking.
and burnout in the workplace when all he does is go into the hospital late and leave early, which isn't exactly true, by the way.
Yes, it is.
However, radiology experiences a significant amount of burnout, mostly due to the increased demands on imaging requirements per person, which means you have to read faster and more studies in a smaller amount of time, which is usually more than you can handle. You can imagine how that would lead to burnout. The next reason why I think healthcare workers are leaving medicine as a whole is because of the pay. I think especially during the pandemic, we've seen many fields that can make more money than healthcare workers make, especially with not having to deal with all the stress that healthcare workers have to deal with.
I don't know. I mean, I looked up these numbers and I feel like physicians seem to be doing okay for themselves. According to the previously mentioned AVMA report, the range in veterinary salaries actually goes from $87,000 to $370,000 a year, which is pretty... Oh, I'm sorry. That's actually the average student loan debt coming out of school. The average starting salaries for veterinarians in different industries is displayed here. And the moral of this story is I never want to hear about doctors complaining about salaries ever again.
Next reason why I think people are leaving healthcare is because there is lack of empathy. You're probably like, what do you mean? We have plenty of empathy towards our patients, but that's not what I'm talking about. The lack of empathy I'm talking about is from administration. I've worked in many different hospital systems. Some of them are very good and some of them don't really care about healthcare workers. And a lot of those bad ones only care about one thing, and that's the bottom line. The healthcare workers are not really top priority.
I myself have had very similar, if not identical, experiences working in both private practices and corporately run practices. There doesn't seem to be any sort of direct correlation between corporate practices being more greedy or less greedy than a private practice. It really just seems to be run of the luck as far as who you get to work for. And I've seen the really good and the really bad.
Quick disclaimer here, I love the current organization I work with, so this does not include you. Next reason why I think people are leaving healthcare is because reimbursements continue to go down. Now, I know we already talked about pay, but I just want to touch on reimbursements as well, because a lot of you all probably don't know how physicians get paid. Reimbursement rates are basically rates for certain procedures or surgeries or clinic visits, etc., that Medicare, Medicaid, and insurance companies pay physicians or other providers.
Now, I totally advocate for the use of pet insurance in the veterinary world. I've seen it save the lives of so many pets because owners wouldn't be able to afford the cost of care of things like I and other specialists do, or really just vet care in general. But this whole like third party sort of thing that human medicine has going on is so beyond my comprehension. It would be so strange and frankly terrible if a system like this infiltrated into the veterinary world.
Every procedure, surgery, office visit, complaint, etc. has a certain code, and each code bills a certain amount. And obviously the amount that the code is billed for depends on how complicated the procedure is, how complicated the surgery is, how long the visit is, a whole bunch of other factors that go into it that we're not going to get into today.
I mean, that literally sounds like hell on earth. Like I'm picturing Lumbird from Office Space coming over to check on, I guess, like a procedure you just did.
We have sort of a problem here. Yeah, you apparently didn't put one of the new cover sheets on your TPS reports.
Oh, yeah. I'm sorry about that. I forgot.
Yeah. Did you see the memo about this?
Down, which means you have to work harder, longer hours, all to make the same pay as the reimbursements go down. And as you can see, just to maintain your current salary, having to work harder, longer hours can obviously facilitate and hasten burnout. Now I'll give you a quick radiology example because that's pretty much all I know. So say I'm a neuroradiologist that gets paid $20 for every MRI brain that I read.
I think he may have left off 1, 2, or maybe even 3 zeros off of this example. No, but in all seriousness, this does sound pretty crappy. Most veterinarians are paid on production to some extent, so you'll always get some percentage of what you are producing for the clinic. So if the cost of services go up in your practice, you will earn more because you're earning a percentage of that number at the end of the day. So it kind of scales a little bit better than what he's describing.
So let's not forget those criminals who are charging so much for medical school. Student debt is becoming out of control at this point. Some schools are charging $100,000 per year, which is absolutely insanity. In fact, the average physician debt graduating medical school is around $200,000 to $250,000, which is about accurate for me.
And let's also not forget about the criminals who are increasing the cost of veterinary school to the outrageous levels that it is today. The AVMA report also showed that the average veterinary educational debt is growing at a rate 4.5 times faster than the average veterinarian income coming out of school. In addition, there is no evidence to suggest that different schools create different starting salaries for veterinarians. For these two reasons combined, I always recommend to young people who want to become a vet to go to the cheapest school possible.
So how exactly do we prevent healthcare workers and physicians from quitting medicine altogether? So let's get into a little discussion about how we're going to fix this mass exodus in medicine. Now, this is coming from the authors here of this paper that we talked about earlier, and they say that we should make the employees feel valued. Everybody wants to feel valued after all. They say feeling valued by one's organization reduces the rest of healthcare workers intending to cut back their hours or leave altogether. The author offers suggestions to the employers that they should consider lessening the workload on physicians and staff as well as reducing hours worked. So I think this is pretty obvious, right? If you don't want people to leave medicine, just pay them well and tell them to work less.
Breaking news, if you work less and earn more money, you might be happier.
And they also offered some suggestions on how they can fight burnout for the healthcare worker. Honestly, you can create supportive environments. How enlightening. You can
Create a supportive environment. Everybody's just support each other, and that'll help.
ensure access to services for mental health, which I totally agree with.
I totally agree with that as well. And a lot of hospitals these days are getting an in-house social service worker to help with that.
Reduce workload via better teamwork. That's kind of hard to develop, but still agree here. You can even apply a systems approach to interventions aimed at improving organization culture and practice efficiency. I just love this. This is like such a corporate answer.
I almost spit out my coffee because in reading the AVMA report on some solutions, they said literally the exact same thing, just with different words. Let me read it to you. Veterinary practices are experiencing operational capacity challenges. In order to meet the demand for animal healthcare services, practices can focus on better staff utilization and improved use of technology to increase productivity and expand capacity. Yes, we could do that in theory if people were incentivized to stay in the field.
Now, aside from all this corporate jargon here, the real way to prevent burnout and mass exodus of physicians and healthcare workers is to pay them well and not overwork them. It's really that simple.
And from what I can tell, it's that simple in the vet world too.
It's a simple equation that, for some reason, just isn't accepted. Now, at the end here, I'll leave you with a quote from the article. Healthcare workers ultimately want to help patients, and their ability to adequately do so is taking its toll. Healthcare workers aren't exiting the field because they can't handle their jobs. They're quitting because they can't handle being unable to do their jobs, which I think is a fantastic quote. Should put that on a t-shirt. So do me.
I think that's a fantastic quote as well. It applies to veterinary medicine. Now, after this, he says to do stuff like and subscribe to his channel. I would not recommend that. I would recommend liking and subscribing to my channel and perhaps leaving a comment about what you thought about this video and if you can come up with maybe any other similarities and differences between human medicine and veterinary medicine. All right, guys, I hope you enjoy this video. I'll see you next time.